Hello, my name is Erin and I'm going to be showing you how to change a dry sterile dressing. So the first thing I'm going to do is some hand hygiene, and I'm going to introduce myself to the patient and ask for 2 identifiers, last name and date of birth. So I've got those. Now I'm going to explain to the patient what we're going to be doing and obtaining verbal consent. So I'll explain that I'm going to change the dressing, and once I get the go-ahead to proceed, then I will put on my non-sterile gloves. And while I'm doing that, I'm looking at the wound here on the arm. Making pleasant conversation with the patient, keeping them comfortable and calm. These are a little small for me, but there we go. So I know I'm gonna peel the tape up very gently. Fold it over the top. Being very careful not to tug at the skin or go too fast. So then I'm going to lift up on the old bandage, the old gauze, and if it comes off easily, I'll dispose of it, but if not, if it gets stuck or it's not coming off easily, I would irrigate it with saline. I would actually let it soak for a few minutes and come back and try again. So let's say I've done that. I can throw the old bandage away in my biohazard bag over here. So then I'm going to visualize the wound here and check for signs of infection, see if there's any drainage. If it looks good, the next thing I'll do is change out of my gloves. Wash my hands again. And I'm gonna open my sterile gloves onto my sterile work surface here, which I've already done. So I'll put these on. I'll start with my dominant hand, which is my right hand. So I'll use my left hand. And these are really small, so I might struggle a little bit. I'm not supposed to be touching that part, but these are the wrong size. So. And then I'll take the other glove. Again, these are sterile gloves. Touching just the edges of the cuff. Pulling that up as far as I can. There we go. And the next thing I'll do is get my iodine to disinfect. So iodine is a disinfectant. So open the package here. I'll be very mindful that this can stain clothing and anything really. So using the regular trash for that. So I'll take my swab and I'll disinfect. Use 3 of them. And I'll be explaining what I'm doing, narrating this to the patient. Last one. Okay, all done with that. The next thing I'll do is clean bandage. I'll get the clean bandage, of course, with my sterile gloves. And I'll make sure this is the correct size to go over the wound. So got that. I'll place it over the wound. I'll get my tape, which is an adhesive sterile wrap. So I'll gently apply just a little pressure, explaining what I'm doing, going around the bandage, the gauze here. To cover it one more time. Don't want it too tight, and then we'll tear it. Done with that. The next thing I'll do is remove my sterile gloves. Put those into the trash. And then I'll do some hand hygiene. I'll make sure I did what I said I was gonna do, looks good, and then I'll go to my chart and document what I just did. And that's how you change a dry, sterile dressing.